female and male reproductive anatomy and physiology. So the external female reproductive organ is composed of the mons pubis, symphysis pubis, prepuce, urethral orifice, hymen, vaginal orifice, perineal membrane, the anus, and external anal sphincter. The clitoris is composed of the body, glands, and labia majora and labia minora. The external female reproductive system is also known as the vulva. Protected, they protect the urethral and vaginal openings, and it is highly sensitive. The mons pubis or mons veneris is soft-rounded, fatty pad or cushion over the symphysis pubis. Covers with curly hair with triangular area called escu- escutcheon. Escutcheon. Tama ba? Escutcheon. And the function is it protects the symphysis pubis. The labia majora, or the bigger lips, or the two folds of skin with sparse hair, is homologous to the scrotum, and it contains fats and Bartholin glands. The function is it protects the labia minora and vaginal opening. The labia minora, or the two thinner folds of delicate tissue within labia majora, is hairless, moist, and reddish, just like the mucous membrane, and with many sebaceous follicles and a few sweat glands. Delicate inner folds, and the function is it lubricates the vulva, swell, and highly sensitive. The labia minora is superiorly superior superiorly tissues of the labia minora coverage, where each is divided into two lamellae, the prepuce and the frenulum. The prepuce is the upper pair emerge, and the frenulum is the lower pair emerge. Inferiorly, the tissues of the labia minora extend to approach the midline and fuse to form the forchete. Forchete. Forchete? Forchette. Forchette. We cut the fourchette for episiotomy. Episiotomy. Tama? Okay, the function is it protects and obscures the vestibule, urinary meatus, and vaginal openings. The labia minora, its function is it protects the vestibule, urinary meatus, and the vaginal opening. The clitoris is a small body of highly erectile, erogenous, and sensitive tissue protected by the labia minora. It is also the key to orgasms. It is composed of stratified squamous epithelium, greater than 10,000 more nerve fibers, sensitive to the touch, pressure, and temperature. The primary site for sexual arousal, excitement, and orgasms. It is homologous to the penis and the corpus cavernosa. It is the guide for sexual arousal and stimulation, and also for urinary catheterization. The vestibule is the almond shape bounded by the labia minora with openings. The urethral opening or meatus or anterior opening lies a short distance above the vaginal opening and below the clitoris. Hence, the clitoris serves as a guide to catheterization in the female. The shortness of the female urethra predisposes the female to UTI. So you should wipe front to back. The vestibules, the second vaginal, number two vaginal opening is the posterior opening. Lies posterior to the vestibule, a short distance below the urinary meatus. often hidden by the opening overlapping labia minora. The labia is open for one child. The hymen, no glandular and muscular elements and not richly supplied with nerve fibers. Nerve fingers, nerve fibers that surrounds the vaginal opening. Very vascular. Can be stretched or torn during physical, tampon insertion, vaginal examination, or sexual intercourse. The appearance of hymen cannot be used to determine sexual activity. The function is it protects the opening of the vagina and separates internal from external reproductive organs. If wrong hole for catheter, keep catheter in guide, then place again for urethra. Tama ba? Scans gland, two small palpable glands that open into the posterior urethral wall. It secretes mucus and lubricates the vestibule. Bartholin's glands or vulvovaginal glands are two small palpable glands 0.5 to 1 centimeter in the diameter situated beneath the vestibule on either of the on either of the vaginal opening. The function is it secretes alkaline mucoid material, favors the motility and viability of the sperm. The perineum is the area between the vaginal and rectum and consists of fibromuscular tissue. Can become lacerated or incised. Flat na petite na medyo masikip equals episiotomy. Can add to postpartum discomfort and perineal trauma. Can lead to fecal incontinence. So episiotomy is the ano to? Okay. The internal female reproductive organ is the vagina, a tubular fibromuscular organ lined with mucous membrane that lies in a series of transverse folds called rugae. Function is it receives the penis, exit way for menstrual blood, exit of fetus for childbirth, and protects against ascending infection. Vaginal reaction is acidic with a pH of 4 to 5. The cervix is the lower part of the uterus that allows sperm to enter and menstrual discharge to exit. It is smooth, firm, and donut shaped. Before childbirth, it is small, rectangular, or oval. The cervix after childbirth, the opening is converted in after childbirth, the opening is converted into transverse slit that resembles slips. Alkali environment that protects sperm from acidic environment in the vagina. In ovulation, it is the thinning of mucus most likely get the woman pregnant. Can store live sperm for 2 to 3 days. Okay, so figure A is the nulliparous cervical opening, and the figure B is delivery. Nulliparous is no delivery or in the cervical opening. The paracervical opening is when it is in delivery. Okay, the uterus is pear-shaped at the top of the vagina, also known as the bahay ng bata. Uterine weight is in non-pregnant women 60 grams or nulliparous. Once nulliparous, it becomes 80 to 200 or 120 grams. For pregnant women, it becomes 1000 grams. The uterus is relatively thick from 0.5 to 5 millimeters. It has three layers: endometrium. Hmm? What's that? The three layers: endometrium, the innermost, myometrium, muscular middle, and perimetrium, the outer layer. The endometrium undergoes constant changes during menstrual cycle, also known as decidua in pregnancy. The myometrium controls bleeding during the third stage of labor and it responds to stimulation by oxytic drugs. Oxyto- Oxytocic drugs. The perimetrium is formed by the peritoneum, continuous with broad ligaments on the sides of the uterus. The position horizontal and it leans forward, also known as anteverted, ab- and abnormal turning backwards of the entire uterus, also known as retroverted. The disadvantage of a retroverted uterus is low progesterone. Progesterone. Uterine parts: the fundus, corpus, and isthmus. The fundus of the uterus hardens when contracted. The isthmus and cervix. Okay. Uterine parts. The fundus is the convex upper part between the insertion of the fallopian tubes, most contractile portion of the uterus during labor. The corpus or body is the upper larger triangular portion. The isthmus is the constricted area immediately above the cervix. The lower uterine segment and distance during pregnancy. The corpus, main body of the uterus, highly muscular organ that holds fetus during pregnancy. The inner lining of corpus undergoes cyclic changes. Fertilization equals to most endometrium sheds off and bleeding occurs, also known as menstruation. Fertilization is the embryo attaches to the endometrium, meeting of the sperm plus egg cell. Implantation occurs 1 week after fertilization. Pregnancy occurs 280 days or 40 weeks with no menstruation. This also equals to 9 months. Functions of the female reproductive organs is menstruation, pregnancy or gestation, and labor. The fallopian tube, aka oviducts. Ciliated mucous membrane produces current of lymph that facilitates movement of ovum. Isthmus, narrow portion. The ampulla is the widest portion, site of fertilization. And infundibulum is the funnel shape that has fringed end. The fallopian tube, each tube is about 7 to 10 cm. The cilia is beating hair-like extensions on cells. If sperm is present in the fallopian tube as a result of sexual intercourse or artificial insemination, fertilization of the ovum can occur in the distal third portion of the tube. In the ampulla, Ovaries, paired glands resembling unshelled almond sets. The homologous with the testes. 2.5 2 to 5 grams and is about 4 cm long. The function is the development and release of ovum and secretions of hormones, estrogen and progesterone are two primary functions of the ovary. Another part of the female reproductive organ are the breasts. There are two mammary glands, overlies within pectoralis muscle, composed of 9 lobes, 4 to 18 lobes to be exact, and secretes milk following pregnancy. Size varies depending on the amount of adipose tissue, increases during puberty, and is equal to estrogen hormone. Size does not Size not significant factor for breastfeeding. Green leafy veggies equal like malunggay, the function of lactation or milk secretion and maternal antibodies. Also the source of pleasurable sexual sensation. Maternal reflexes in breastfeeding. Prolactin reflex is the milk secretion reflex, and letdown free reflex or the drought reflex. Oxytocin is induced. The act of sucking and lactating breast stimulates the flow of milk. Female sexual response. Number 1, sexual stimulation. Number 2, clitoris and breasts erects. Number 3, vaginal orifice swells. Number 4, expands and elongates to accommodate penis. Vestibular glands moisten and lubricates. Number 6, the zenith of intense stimulation. Number 7 is the orgasm. Number 8, it contracts. And number 9, it rapidly dissipates. The menstruation or reproductive cycle is when the inner lining of the uterus is expelled by the body. Start of menarche, 12.8 years old, and starts from 8 years old to 18 years old. Not At the age of 8, it's not super active. Pubertal progression are as follows. Thelarche is adult breast development. Adrenarche is armpit hair and pubic hair. Growth spurt is for height. Menarche is first menstruation. Will experience 300 to 400 menstrual cycles within their lifetime. Normal menstruational cycle is 21 to 36 days. Bleeding is 3 to 7 days. The volume is around 25 to 60 milliliters. Factors in irregular menses. Irregular ovulation, stress, disease, and hormonal imbalances. Hormonal imbalances can also be attributed to stress. The menstrual phase 1 to 4 days, vaginal bleeding as the uterine endometrium is shed out. Terminal phase of menstrual cycle, vaginal bleeding as the uterine endometrium is shed down. Menarche is 12 to 13 years old. Amount is about 25 to 60 milliliters or equal to 0.4 to 1 milligram of iron loss. The follicular phase 5 to 14 days usually lasts for 9 days, aka the regenerative phase. Estrogen equal increases 8 to 10 folds. Energy goes up. Ovulation phase is 13 to 15 days, 14 days prior to the next menstruation. Release of mature, non-fertilized ovum. Estrogen is also high. Ovulation signs are breast tenderness. Body temperature increases by 0.3 to 0.5 degrees Celsius. Metal lower abdominal pain, positive for spin Barkey test, and positive for Ferning test or leaf pattern. The luteal phase, 15 to 28 days. LH and estrogen and progesterone is high. Progesterone makes endometrium thick, or preparation for implantation. PMS is also known as premenstruational syndrome. What causes mood swings during PMS? Hormonal fluctuations might trigger a drop in serotonin. This produces irritability, anxiety, among other symptoms. Ovarian hormones. There are estrogen. Estrogen is responsible for the follicular phase, high ovulation phase, fertile cervical mucus, can be thin, clear, colorless, stringy, or lubricative. Produces a fur pattern. Progesterone maintains the pregnancy by maintaining deducin. Drop in early pregnancy equals abortion, or drop in late pregnancy is equal to preterm. Preterm is also known as the lack of months in development. Thermogenic is heat luteal. Menopause, or marking the end of the reproductive abilities, occurs between 45 to 50 years old. Can induce hot flushes, emotional changes, sleep disturbances, obesity, sexual drive is not diminished, and atrophic changes of vagina. This may be dyspareunia, 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 and breasts become pendulous. In menopause treatment, we have estrogen replacement, vaginal cream or lubricants, vitamin E, increase in calcium, and provide emotional support. Moving on with the male reproductive system, the penis is structures that include the body or shaft, glans penis, and urethra. The primary function is pathway for urination, and the organ is used for intercourse. The male reproductive system is also composed of the scrotum. The structures include the testes, epididymis, and the vas deferens. It is a loose bag of skin and connective tissue which holds the testes suspended within it. Normal temperature is slightly cooler than the body temperature. The prostate gland secretes a milky alkaline fluid and enhances sperm movement and neutralizes acidic vaginal secretion. The epididymis is a cold tube-like structure on the posterior surface of each testis. Sperm complete their maturation within the epididymis. The vas deferens extends from the epididymis into the abdominal cavity and in the abdominal cavity. Ejaculatory ducts are there are two ejaculatory ducts. Receive sperm from ductus deferens and secretions from the seminal vesicles. They empty into the urethra. The seminal vesicles produce secretions that contain fructose, which is an energy source for sperm. Secretions are alkaline, which enhances sperm motility. The urethra is the final duct that the semen passes through as it exits the body. The penis consists of smooth muscle, connective tissue, and body sinuses. When flaccid, the blood flow is minimal. When erect, it is filled with blood. Ejaculation, the volume is 2 to 4 milliliters. The count is 200 to 4 million. Only 200 can reach the ampulla. Fertilization is 5 to 30 minutes after ejaculation, and the lifespan can live 5 days in the vagina. Ejaculatory incompetence, however, is premature ejaculation or early ejaculation. Causes are nervous, lack of attraction, psychological factors. In severe causes, retard ejaculation, which is delayed, and retrograde ejaculation is lesser than 2 to 4 milliliters. A reason of which is the semen might go to the bladder. Male sexual response. There are four phases of sexual response in males: excitement, plateau, orgasm, and resolution. So step by step is number one, stimulation; number two, increased blood flow; number three, erection and elongation; number four, orgasm; and number five, emission or ejaculation. That concludes lesson 4 of the male and female anatomy and physiology.